Coming from that to the history of pain management, it's a long history again. In the 1600s, many European doctors gave their patients opium to relieve pain. And pain was mostly considered a problem to manage in acute care, like after injury or surgery only. Some patients complaining of pain and become drug dependent, so were seen as drug abusers. Patients who didn't want to use drugs or couldn't access them turned to psychotherapy or were referred to neurosurgery even. In October 16th, 1864, in Boston, by tomorrow it will be exactly 174 years, William Thomas Green Morton is a genius who participated in a public demonstration for ether anesthesia after trying it on himself and then trying it on a patient for painless through tooth extraction. And this was the first time to be used in anesthesia. Then surgeon couldn't long resist their new power to perform longer and more complex procedures, and most patients thought anesthesia was a divine blessing. By the 1900s, morphine and heroin came into use as pain medication. It was also the start of doctors being torn between wanting to improve the quality of their patient's life while fearing the treatment would make people vulnerable to addictions. In 1537, Ambroise Paré, a French barber surgeon in the Royal Army, brought to the field of surgery a revelation that a surgeon might treat patients while simultaneously limiting the pain resulting from treatment. So when they were amputating the wounded arms or legs, they were pouring boiling oils. So he treated from his side the wounds with a mixture of egg yolk, rose oil, and turpentine. He used silk to apply sutures to stop bleeding. Others were applying boiled oil to stop bleeding. So tremendous pain was an accepted part of surgery. For Ambroise Paré, the benefits of a gentle hand during surgery would soon become a clear means of reducing the suffering of his patients. After discussing that part of pain, we have to come to a point to talk about chronic pain. Chronic pain is still one of the most difficult conditions to treat. It's defined as pain that persists for at least 3 to 6 months. This definition is clinically useful, but it doesn't give any insight into the mechanism and doesn't point out when the transition from acute to chronic pain occurs. Clinical literature on this topic suggests that the transition point is presumed to occur around 3 to 6 months point or earlier. But pain is very individual in that matter. The only way to tell if someone is in pain is to ask him. Another reason chronic pain is so complex to address. To address it, that critics about the condition are partially correct. It is to a degree in your head, though not in the pejorative sense, because pain signals travel through the body's nervous system, but so do emotional and cognitive information. As people develop pain conditions, they become anxious, and that anxiety reinforces the pain signals. So the more you think about pain, the more pain there will be. Many groups are now using the RNA sequencing to gain insight into pain mechanisms and patient population to illustrate the mechanism of neuropathic pain. There are some factors might affect the transition of acute pain to a chronic one. Inflammation, tissue, tissue plasticity, hypersensitivity, hyperexstability, nerve injury, neuropathic pain, and surprisingly, there is some factor that really very surprising, the gender differences. This gender differences based on baseline gender differences in nervous system, immune system, sex hormonal regulation, sex chromosomes, length, regularity gene, product, gender specific diseases, gender differential comorbidity, gender differences in lifestyle, and differences in access and the quality of healthcare. The genetic factors may have a role in some pain conditions, such as familial hemiplegic migraine and juvenile idiopathic arthritis. So children of chronic pain patients are more likely to develop pain problems than the children of pain-free parents. However, the literature suggests that in many instances, environmental factors are likely to have a significant role and may render children whose parents have chronic pain more vulnerable to experiencing pain themselves. Many studies in this field are compromised by small samples and a reliance on retrospective reports. Another important aspect of pain actually is the psychosomatic pain. It is defined as symptoms of physical pain in different body areas occurring during any period of life, letting the patient seeking medical help in different specialties that might necessitate actually many investigations trying to reach up to a diagnostic surgical procedures without any satisfactory results. It is known to cause disruption of social and occupational activities sometimes. It is the right actually of every patient seeking treatment to go through what we call etiological analysis, means trying to find a proper diagnosis or cause for the symptoms, mainly the pain. But actually, this pain can be expressed by stress, migraine, tension headaches, hypertension, respiratory symptoms, gastrointestinal disturbances, pelvic pain in females, impotence in males, frigidity and decreased libido or sexual desires in both sexes. Sometimes dermatitis even, and skin ulcers. Once we can't find any organic illness might cause that discomfort, here only we should think of psychosomatic disorders. This type of disorder can be caused by stress, depression, or other mental or psychological disorders that should be dealt with by a specialist. We can't talk about pain without mentioning something about a delicate issue that since 2006 had become the most active area of research in the medical ethics. It's the euthanasia. The British House of Lords Select Committee on Medical Ethics defines euthanasia as a deliberate intervention undertaken with the express intention of ending a life to relieve a long suffering. Other countries like Holland and Belgium, for example, have broader definition of the matter. Hypocrites appears to have spoken against the practice, writing, "I will not prescribe a deadly drug to please someone, nor give advice that may cause his death." This is thought to be applied to euthanasia. Thank you very much for your attention, and I hope that you have enjoyed with me this painful journey in the labyrinth of pain.
Thank you very much. It was indeed a very heavy topic and a heavy presentation, and I'm sure there will be a very long discussion after this, because from history to philosophy to ancient medicine to modern medicine and all the debates that we have nowadays. Thank you so much. So now if anyone has questions. So there is Ghada who wants to ask a question.
First of all, I'd like to thank Dr. Alaa for this informative lecture. And I have a question that might be surprising to you.
I'm never surprised by your questions.
Actually, I'd like to know what was the motive behind choosing this complicated topic, actually. It's really interesting.
Yes.
So I would like to know what was in your mind.
I don't know. Actually, I leave myself to the reflexes. You know, when I've been asked to talk about the subject, this is the subject came to my mind, and I try not to choose something very an obstetric. You know, I'm trying not to live the obstetric part in my life every day. So I found that from the medical point of view, I can put some inputs, but also for the type of the Agora-like place of cultural thinking. So the idea to give actually, and I didn't have any intention, as I said in the beginning, and Nevyne also mentioned that this subject is very tough and vast. You can't cover it in half an hour. That's why it took 43 minutes almost. So the thing is that the idea is to give the audience ideas, to give the audience the chance to have points to think of, to read about, and to increase our knowledge in that. To open windows of knowledge. So I found that subject is really extremely interesting in that matter. And in my mind, it represents the type of questions that really we can raise in such a place like Agora.
Actually, I loved it, and you presented in a very artistic and philosophical way that I have never thought of. Actually, usually I just think of pain as something related to our work. So I'd like to thank you so much.
Thank you, Rada. Thank you for your comment and question. Thank you.
We have Iman who has a question.